Hello everybody again. We're here to talk a little bit about gynecomastia surgery. Now, you might want to regard this video as part two. Last video we talked about scars and what those involve. In this video I'd like to talk to you a little bit about the recovery immediately after the surgery of gynecomastia surgery. Obviously, recovery is a very, very important aspect for everybody who's undergoing any surgery. They want to know what it involves, how much downtime they're going to have, what the kind of care is, and what's required of them. So basically, in order to help people and understand what they'll need to take into consideration following surgery, you need to know that surgery takes just under an hour to do. You wake up straight afterwards, thanks to modern anesthesia these days, which is great, and you're back in your room, and many times you think, how the heck did I get back here? But anyways, that's another matter, but anesthesia these days is great. So you're back in your room, and you're giving somebody to eat and somebody to drink, and then you're going to have a special cooling device in your chest. Now that's there basically to reduce your swelling and bruising. And it's been really, really quite helpful at reducing those elements after any surgery. And this is the compression vest or torture device that we get you into after the surgery, okay? As you can see, it's Lycra, quite stretchy. It opens up at the front. Oops, sorry, you can't see it here. Here you go, you see it opens up at the front. It's sleeveless, and it is quite tight fitting. In fact, here's Matthew. I'm just going to show you. Now, Matthew hasn't had any surgery. He's just basically trying this on for people to understand. So you can see it's quite tight fitting. It's quite snug, but it gives you a nice sort of, we try to tuck it up here so it doesn't crease at all. But yeah, it's fairly firm and flat. You can hide it quite readily under a t-shirt, a shirt, or anything like that, even your shirt and tie, jacket. It's not a problem. There you go. See, nobody needs to know that you've had any surgery at all. So you got to wear that 24/7. Sure, you could take it off to shower, take it off for half an hour, whatever. You have a little bit of a break, but generally, by and large, wear it as much as you can first 2 weeks. So you then go home after the same day after the surgery. The thing is, though, this: we need to see you the following day. Why do we need to see you? The reason we need to see you is because I put in a series of stitches on the skin, almost like a quilt effect. It looks a bit scary, to be frankly honest with you, but it's quite a simple sort of concept, okay? There's two possible main side effects or possible complications with this operation. One is infection, the other is bleeding. Now, infection is pretty rare these days. We have antibiotics, which really take care of the vast majority of the time, and it's pretty rare to have an infection after this type of surgery. Bleeding, however, can occur with any operation. Now, just to put you into the mindset of what's happening here, when we remove the gland and the fat behind the skin, okay, there's an empty space behind the skin, effectively, behind the skin and the muscle. And that's why we put the garment on, to actually press the skin against the muscle so it knits and heals in that position, okay, so give it a nice sculpted look. But that takes time. And in the first few hours after the surgery, you have injured or traumatized blood vessels, leaking blood vessels, which in the vast majority of the time seal off and heal and don't sort of drip any blood. However, in a small percentage of patients, they keep dripping blood like a leaky hose pipe. Now, if you have an empty space there and you've got a leaky hose pipe, it's going to fill up. And what it fills up is with blood. And it can be quite impressive if it does happen. Over the years, we've tried various things to try to minimize this, including putting cold packs, compression, all these drains. Now, none of them have been entirely successful until about 6 months ago, when I started using this technique where I put a few stitches from the skin onto the muscle to effectively quilt the skin back onto the muscle. That way, the skin can't lift off, even if there are leaking blood vessels. So it effectively stops. And that's really done the trick quite nicely for us. And in the last 6 months we've had 0 hematomas, which is great. But because these stitches need to be removed, you have to come back to us the next day. Now, why do we remove them the next day? The reason is simple. If you leave stitches in longer than 48 hours, they usually leave permanent marks in the skin. However, if you remove them earlier, then there's no marks in the skin. Also, we take about 24 hours because by that time, the danger of bleeding is usually stopped. Those are the two main reasons why we have the stitches in and why we have to remove them. Then get you back into your compression garment, get your shirt back on, and if you want, you can really go back to work within 2-3 days. Now, if you're not a manual laborer, office work is perfectly suitable at 2-3 days. Pain is quite well managed. It's actually not a particularly painful operation. The patient is quite comfortable to get back to pick up the phone, back to the computer, the laptop, whatever. Obviously, if you do a little bit more intense labor-involved job, then you probably not need to wait maybe about 10 days or so. We don't really want you to do too much strenuous cardio work, okay? And with that in mind, just understand that going back to the gym, about 2 to 3 weeks, you should be absolutely fine to slowly get back in the gym. Again, I tell people, listen to your body, use common sense, okay? If it hurts, if you do something that hurts, your body's telling you, don't do it. As long as you keep that in mind, you should be absolutely fine to get out and about and do various things. So I do hope that this was helpful for you, in putting you in a little bit of picture in terms of what you need to look out for in the post-op period after gynecomastia surgery.